We are going to discuss about the distribution and elimination of drug. Now already we have discussed about the drug absorption. Now when the drug it will be absorbed, for example, if we are considering this one, for example oral route, whenever we are taking the drug through the oral route, it will go to the gut, and from gut it will again come back to the, means it will enter into the plasma through the liver, clear, through the liver, because again the portal veins and all are there similarly, and some it will be excreted. Now, or you can say that if it is intramuscular tissue, then that is the tissue reservoir. Wherever we are injecting the drug, then it will enter into the plasma. Intravenous means directly into the plasma. So from the different routes, whenever we are administering the drug, they will enter into the plasma. After entering into the plasma, that means blood, the drug it will be bind to the particular plasma protein, and the free drug it will enter into the different tissue or different parts of organ. Clear? In the organ, for example, again free drug can go to the liver, can kidney, or adipose tissue, or you can say that in the muscle, etc., etc. And there also the drug can be present into the free form, or it can be you can say that they can bind to the proteins, clear, plasma proteins. Now the distribution of the drugs means after administration, that is the drug it will be distributed into the different body compartment or the different body part, that is we are calling as the distribution of the drug. Now that is the extent and pattern of this distribution, when how they will be drug it will be distributed, and the pattern it will be depends upon the lipid solubility, ionization and physiological pH, then extent of binding to the plasma and tissue protein, presence of tissue specific transporter, and different regional blood flow. So these are the major you can say that factor uh, which is mainly responsible for the extent and pattern of the drug into the different body compartment. Now, if we are talking about the volume of the distribution, now in case of the volume of the distribution, what is mean by the volume of distribution? The volume of distribution is a pharmacokinetic parameter presenting a individual drug propensity to either remain into the plasma or distributed to the other tissue compartment. That means what? The volume of distribution, it is a pharmacokinetic parameter. This is a you can say that nature of the drug, that whether the drug after entering into the plasma it will remain into the plasma or it will be distributed into the different body compartment. Now you can say that the definition Vd, or the volume of distribution, it is proportionally constant that relates to amount of the drug to the body and plasma concentration in a given time. So it is proportionally constant, the total amount of the drug present into the body and plasma concentration. So there is a proportion. So here Vd means actually volume of distribution is Vd, with L is the in liter we are expressing. Now what is the equation for Vd, or the volume of distribution? Amount of the drug in the body in mg divided by the plasma concentration of the drug, mg per liter. So the volume of the drug volume of distribution, it is into the, we are expressing into the liter. Now if we are considering this equation, a drug with a high volume of distribution or increased volume of distribution has the propensity to leave the plasma and enter the extravascular component of the body, meaning that high dose of a drug is required to achieve a given plasma concentration. What does it mean? If we are from this equation, what we can understand, that if the Vd, or the volume of distribution, the value of volume of the distribution or the Vd high, then what does it mean? The drug will be more distributed into the other tissue. Then more distributed into the other tissue, and plasma concentration it will be less. So we required a more drug to achieve the plasma concentration. Conversely, if it having the low volume of distribution, any drug, then what does it will remain into the plasma more amount, corresponding amount, more amount, and we require the low dose of the given drug to get the desired plasma concentration. So low VD means less distribution into the other tissue. So we can say that generally lipid soluble drug do not enter cell. VD means volume of distribution approximately extracellular fluid volume. Streptomycin, gentamicin is you can say that 0.25 liter per kg, and distribution is only matter of the dilution, means you can say, and because there is a number of the other factors are involved like protein bending and etc. Now, drugs extensively bound to the plasma protein are largely restricted to the vascular compartment and have the low value, clear low value, and which is almost 99% of the plasma protein binding. We can see for the diclofenac, and their volume of distribution is 0.15 liter per kilogram. So, for example, if we are giving the 1,000 mg of the drug, this just example 1,000 mg of the drug, and we are getting the steady state plasma concentration is 50. We are getting the steady state plasma concentration 50. So volume of distribution is 20. So by this equation, we can calculate the plasma volume or volume of distribution of drug.